Sinus infections, respiratory allergies, and other problems of the ears, nose, and throat affect the lives of millions of people each year, making it one of the most common health problems in our country.
Throughout my life, I'd had chronic sinus issues. I was unable to breathe most of the time through my nose. I would wake up in the middle of the night choking on drainage. I was having a lot of sinus bleeding.
My life basically revolved around when I felt well, when I didn't have a headache, when I didn't have sinus pressure or congestion.
It was pretty bad. It was year-round. Every time the weather would change, there's always something.
It's a broad spectrum of problems that can be improved or even corrected under the care of an ENT, or ear, nose, and throat physician, who specializes in otolaryngology.
Otolaryngology is essentially ear, nose, and throat. Initially when Jim came in, we were talking about recurrent sinus infections and chronic drainage, a lot of congestion, and he had a deviated septum as well as chronic sinus infection. And so the first thing we did was tackle the anatomy.
When it comes to respiratory and sinus problems, Dr. Patricia Bell says there is a common misconception regarding the reason behind most respiratory symptoms. The simple truth is, all that sneezes is not allergy.
All that is green is not infection. All that sneezes is not allergy. And if you are someone that suffers from recurrent infections or chronic symptoms, think about whether it may be an allergy that's driving it, or think about if it's truly recurrent or chronic infection. To see an otolaryngologist would be the individual to be able to help differentiate between the two. When I first meet a patient, I want to know what the #1 symptom is that bothers them the most. And that's going to allow me to make sure that we get the relief that we're looking for. For some people it's the headache, for some people it's the nasal airway, for some people it's the drainage down the back of the throat. And when we talk about the specific symptom, that's what helps me determine also what kind of testing we need to do.
Many of the patients at Dr. Bell's Family ENT and Sinus Center of Harrison, Arkansas, have come for the proper diagnosis and management of chronic sinus and upper respiratory symptoms. Here, the need is for patients ranging from children to adults to go beyond the frequent antibiotics prescriptions they may have received from primary care providers and look into other options, including allergy testing.
At Family ENT and Sinus Center, we have the ability to test in-house the skin testing for the allergy diagnosis.
What I'm going to be looking for is any wheal response. It might look like a mosquito bite, any redness or itching. So if you feel any itching, let me know. What I've done is I've applied the multi-prick devices. Each tine has a little bit of antigen on it, gently abrades the skin and allows the antigen to react with the skin. What I'm looking for is redness, which we've got here, and a definitive wheal that would indicate that she has an allergy or a positive response to that antigen. The testing, is important. The diagnosis is important. There are many people that are afflicted with asthma, bronchitis, recurring sinus infections that no matter how many treatments they get with antibiotics, inhalers, if you're not, you got to treat the cause of it, not just treat the symptoms. That's the most important part.
Treating the cause of allergies and upper respiratory ailments often is done through a process called immunotherapy.
What immunotherapy does is it allows us to give increasing doses of the things that they're allergic to so that their body starts to tolerate the exposure rather than see it as an enemy, something to respond against. When you look at the things that trigger asthma, they're the same things that trigger allergies. So by changing the immune system with the immunotherapy, so they're less likely to develop the allergy symptoms, they're also less likely to develop asthma and have the triggers with that. I actually have several children in my practice, and the thing that I commonly hear is that these are children that enjoy being out playing soccer. They want to be out with their friends. They don't want to live on antibiotics and have to take all the medicines. And so by doing immunotherapy, I'm finding that even within the next season, that they're out able to play soccer, play basketball, play softball, and they're able to stay with their friends and not feel short of breath, and they're able to concentrate better too.
I'm not near as much as congested, or I can breathe a lot better when doing football and things like that.
I feel a lot better. I can be myself and enjoy the things that I love to do.
However, if sinuses are chronically infected or the patient's anatomy prevents proper function, even the best allergy management cannot alleviate the symptoms. That may be when sinus surgery, including balloon sinuplasty, is needed, which Dr. Bell offers with the most advanced procedures and equipment at the nearby North Arkansas Regional Medical Center in Harrison.
When you look at a sinus CAT scan, it's important to evaluate for nasal polyps, closed anatomy. Extra sinus cells can be present, and that can create more obstruction. And those are the things that immunotherapy, antibiotics, and allergy medicines are not going to rectify, and that's when the sinus surgery comes into play.
Sinus surgery, such as what is being done today, uses a protocol called fusion technology.
That's a stereotactic image guidance system that helps navigation within the sinuses. What I've done is I've talked with this patient obviously about their symptoms, and we've established that the CT scan has demonstrated some areas that are problematic. He has polyps that are present, and he has sinuses that are scarred closed. And so what we've established is that we need to open those up so that we can decrease his nasal symptoms, his sinus infections, and also decrease the reactivity that we've been battling as far as his asthmatic disease goes. He will be breathing much more freely through his nose. He will have less drainage down the back of his throat, fewer headaches, fewer sinus infections, which means that he will not be living on antibiotics and oral steroids.
It's a totally different story. It's almost like a second lease on life. I can breathe, exercise is easy, work is easy. No more waking up in the middle of the night choking, so I wake up rested. I feel like a new man, I really do.
The key is knowing that there are other ways besides antibiotics to manage allergies and respiratory problems. Options that will help patients breathe easier and feel healthier on a daily basis. For more information, visit narmc.com.